Taoiseach, 9 months ago the country, as you know, voted en masse to repeal the 8th Amendment and to allow abortion rights, and it was a truly historic referendum, with the central message being clear that people with a crisis pregnancy should be cared for here in Ireland and shouldn't be forced abroad. People should be able to make these decisions freely, without barrier or obstruction. Now, we heard in the last 24 hours that women may face intimidation from anti-choice zealots in hospitals and clinics and car parks, and the Taoiseach needs to give the date for urgent safety zone legislation. But we're also hearing of women struggling to get access or are left outside of the law. Today I want to ask you about women with tragic fetal diagnoses, people who had such an impact in the referendum. There's worrying signs that the very women whose stories resonated throughout the country are still being forced abroad. A number of women have contacted my office, and three of them have had to go to England for terminations for medical reasons. In the latest case, let's call this woman Mary, who's contacted me. She had a scan in Portiuncula Hospital. An obstetrician told her there was a nuchal translucency with fluid around the neck of 8 to 9 millimetres and possible Edwards syndrome. She was told there was only a 15% chance of delivery and the baby might live an hour or so. But the doctor then said, for whatever reason, that they couldn't do anything as she was over 12 weeks. Mary was handed the name of 3 hospitals in England. She also said, by the way, a staff member treated her like a leper after this point. Mary later rang the HSE and was directed to Galway University Hospital, where, despite her GP phoning and apparently making an arrangement for a scan, a doctor told her on arrival, "Nobody here to see you, and you won't get to the second trimester." At which stage Mary and her husband had had enough. They walked out, and within hours they had made an appointment to go to England. But of course at great expense, having to have children looked after, work arrangements, etc. As Mary said to me, "I'd lose my head if I had to continue this pregnancy, but Ireland will do nothing for me." Now, all the women who've contacted have individual situations, but they all have one thing in common. They voted last May, never knowing they were going to face this situation, and all of them thinking that if they did, they'd be cared for. They've asked me to put these questions to you, Taoiseach. Why in other countries can a pregnant person sit down with their doctor, get all the facts, and then come to a decision with their family? Why in this country is such a distinction made between fatal and severe abnormalities that isn't made in other countries? One of the women, who's a nurse, asks, who makes the decision about what conditions get on the list to decide what is a fatal fetal abnormality? And what does it vary from hospital to hospital? They also ask, why was a 28-day rule introduced, which is very difficult for doctors to live by? That was never part of the referendum conversation. And finally, Taoiseach, do you now agree that a conservative Catholic control of hospitals and a very narrow law with criminalisation is having a chilling effect on forcing such women abroad?
Taoiseach.
Thanks, Deputy. This time last May, the people of Ireland voted in overwhelming numbers to make abortion legal in Ireland in certain circumstances. I believe that abortion is very much a private and personal matter, and I don't believe that any woman decides or chooses to end her pregnancy lightly. And no woman seeking this service, and no doctor or midwife or nurse or anyone else involved in providing it should be subject to intimidation in any way in the course of going about their work or seeking to avail of what is now a legal health service in Ireland. As deputies will be aware, the legislation to enact and realise the decision made by the Irish people was passed by these Houses. There are now 274 GPs nationally who've signed up to provide terminations in early pregnancy, and about 10 maternity hospital units who are providing the service. When you consider that roughly between 10 and 14 women end their pregnancies in Ireland every day, 274 GPs are there to help them and 10 maternity units providing that service, and the service will continue to be developed in the months and years ahead. To answer your question in relation to the difference between fatal abnormalities and severe abnormalities, that was a decision that was discussed here in the Oireachtas, and we as an Oireachtas, and you were participating in all those debates, which is why you should know the answer to your own question. We decided as an Oireachtas that disability would not be grounds for the termination of a pregnancy, but fatal abnormalities would be, and a severe abnormality is very often a disability, and that is a decision that we made as a House, that we would make that distinction, and that disability would not be a grounds for terminations after 12 weeks. I don't really want to comment on any individual cases, Deputy. I know that the diagnosis of a fatal fetal abnormality must be a difficult one for anybody, for the mum or the dad, for the family, much wanted pregnancy, and then finding out that something has gone wrong. And without knowing the individual facts of any case, it would be inappropriate for me to comment on them. And I am aware that you've raised an individual case here in the past, the facts of which turned out to be different to those which you laid on the floor of the House, and I think that should be borne in mind.
Thank you, Taoiseach.
Last April at a party conference Fine Gael had, Susan and Tim Corcoran, who was reported in the Irish Times, spoke about their struggle with an Edwards syndrome diagnosis. There's no guarantee they will be able to have an abortion in this country, despite the new law. That's my point. And Taoiseach, you haven't bothered to comment on the problems that women are encountering in reality in our hospitals, and I'm sure particularly in rural areas. What we need now is a review of the law sooner rather than later, particularly the 28-day rule that was never part of the national conversation. And yes, you are right, politicians chickened out on what the Citizens' Assembly recommended, which was severe fetal abnormalities to be considered as well. You're right there. And now these women are paying the price, and it's really not helpful of you to conflate with disability when you know that these conditions are very complex and interact with each other. And finally, Taoiseach, we need separation of church and state. We need fully secular hospitals where there isn't such a culture that really sends people on their way.
Thank you, Deputy.
But where the Catholic Church no longer has a say in these matters and influences medical staff as well. And Taoiseach, we need this sooner rather than later. Are you willing to at least review the 28-day rule, which a lot of people cite as being problematic?
Thanks, Deputy. As I recollect, there is an inbuilt mechanism within the legislation already for review. And again, that's something that was discussed in these Oireachtas, and we decided as an Oireachtas collectively that that's when the review would take place. And this service is new. It was never going to be a case of being able to start the service in one day. Any new service, any new medical service, probably any new public service has to develop and evolve, and it will develop and it will evolve. And unfortunately, it may not be up to scratch for some women and some patients now, but we will see to it that it improves and evolves as it is developed. Although I do take issue with one of your remarks, Deputy. We didn't chicken out. We made a decision in these Oireachtas that disability and severe disability should not be grounds for terminating a pregnancy. We decided that a woman was free to choose to enter pregnancy for any reason or none, up to 12 weeks. But after that, it would have to be because of a risk to her health, a risk to her life, or a fatal fetal abnormality. We decided that as a House. If you want to reopen the debate about whether disability should be grounds for termination,
time is up, Taoiseach. That
is your choice. But it's not that we chickened out, Deputy. We decided as a House, and we said during the referendum campaign when we asked people to vote yes, or at least I did, that we would not allow disability to be grounds for terminations